Hello everyone, now let us discuss about anatomy of musculoskeletal system, humerus. In the current session, we will be focusing on the anatomical components of humerus. So what is humerus? Humerus is arm bone. It is the longest and the largest bone of the upper limb. Humerus is the longest and the largest bone of the upper limb, and it articulates proximally with the scapula and distally with two bones, ulna and radius, to form the elbow joint. Now here you can see the various anatomical components of humerus. First thing is head. So this is the humerus head. And the proximal end of the humerus features a rounded head that articulates with the glenoid cavity of the scapula. This is the scapula and this is the glenoid cavity. Here this is the head of the humerus, rounded head of the humerus that articulates with the glenoid cavity of scapula to form glenohumeral joint, which is nothing but shoulder joint. This is the shoulder joint. And distal to head is the anatomical neck. This is the anatomical neck. The black lines above. Here you can see anatomical neck. Distal to the head is the anatomical neck, which is visible as an oblique groove. It is the former site of epiphyseal plate in an adult humerus. And the next is greater tubercle. This is the greater tubercle. The greater tubercle is the lateral projection distal to the anatomical neck. If this is the anatomical neck, distal to anatomical neck is the greater tubercle. It is a lateral projection. Whereas the lesser tubercle, it projects anteriorly. Next part is surgical neck. The surgical neck is a constriction in the humerus where the head tapers to the shaft. Head tapers to the shaft. This is the shaft or body. Surgical neck is a constriction in the humerus where the head tapers to the shaft. It is so named because fractures often occur here. So the most common site of fractures of humerus is surgical neck. And the next point is between the two tubercle, that is the greater tubercle and the lesser tubercle, between the two tubercle there is a groove named intertubercular sulcus or groove. This is the intertubercular sulcus or groove. One more important point of humerus is deltoid tuberosity. This is the deltoid tuberosity. The deltoid tuberosity is the point of attachment for deltoid muscle. This is where the deltoid muscle attaches. And this is a groove, radial groove, which contains the radial nerve. And now coming to the body or shaft of humerus. The body of the humerus is roughly cylindrical at its proximal end, but it gradually becomes triangular and flattened at the end, at the distal end where it articulates with other bones. One more important distal aspect of humerus is capitulum. This is the capitulum. It articulates with the head of the radius. This is the radius bone and this is the head of the radius. The capitulum of the humerus articulates with the head of the radius bone. And this is trochea. The trochea articulates with the trocheal notch of the ulna. This is the point of articulation for ulnar bone and this is the point of articulation for radius. So these are the various and important anatomical components regarding the humerus bone.